language therapist in the Oxford University Hospital's Community Paediatrics neurodevelopmental assessment team and lead of the Think Autism Project. And Sarah Haden is the consultant paediatrician and clinical lead for the Community Paediatrics service in Oxford. So over to you guys.
Fantastic. Thank you, Myri. I'll start off and Sarah do chip in. So yes, today's been so helpful so far, and it's lovely to go from the training in schools to quite a different programme. So Sarah and I are here to give you a brief overview of the staff training pilot project we've been developing in Oxford University Hospitals in our paediatric children's hospital over the past 12 months. So we wanted to start with a quote from one of our participants. So I think he put it really eloquently here, saying he felt that missing is training for hospital staff and managers that are done by autistic people themselves. Training needs to be from neurotypical minds about the perspective of our disability. But how can a neurotypical simply understand what we experience when we feel or think, or how much discrimination we have to deal with on a regular basis? So I know that we've been talking a lot today about the significant healthcare inequalities we know exist for neurodivergent individuals accessing healthcare services. So we wanted to look at that for our services in OUH, and specifically from a local point of view. I think there's more and more evidence being gathered from a national point of view, and we wanted to hear from our patients in the children's hospitals, so autistic children, young people and their families. So we developed this flyer and we gained the experiences and views from over 100 of our families. We did an online survey, and I know we've talked already today about quantitative versus qualitative data. We also did some in-depth interviews with neurodivergent young people and their families, which were really useful to gain stories and ideas for our training. So we wanted to identify the specific barriers that patients in our OUH healthcare settings were experiencing, and as a result of this, to create an interactive education programme created with neurodivergent children and young people and their families, and delivered by our neurodivergent colleagues as well. So we contacted local organisations. We worked with OUH Parent Carer Forum, Autism Oxford and Autism Family Support Oxfordshire. And the barriers that were identified included challenges in the environment, uncertainty and unpredictability of the processes in healthcare settings, the need for inclusion of patients and their families in the decision-making process, and that idea of control and involvement I know we've been talking about today, and for staff understanding and acceptance of autism and the need for those reasonable adjustments. And we heard from patients that was especially in terms of communication and sensory sensitivities. And I know that has links across the evidence base as well. So using this, we put together a training package. And we delivered it to 130 healthcare staff across OUH Children's Services. I think one limitation when we've been reflecting back has been, I think we really prioritised clinical staff, and going back to our patients and hearing from their experiences, actually that first point of contact in terms of administrative staff and receptionists is also very poignant and very important. So I think re-looking at that as a result of this pilot project and realising that clinical staff need this training, but also looking wider than that, and seeing the experiences of administrative staff and other staff that patients will come into contact with on their healthcare journey. So we discovered that from pre-training questionnaires completed by 96 of the 130 members of staff that we surveyed, that 76% of clinical staff, so there was a huge range of clinical staff that came, nurses, doctors, allied health professionals, play specialists, and we really found that a range of different clinical specialists from different departments really helped with the interactive nature of the training and with discussion. But from this pie chart here, we can see that 76% had not received any previous formal training in autism in quite long careers through some of them. So we found that need, that gap really for training amongst our staff. And our real objectives of the training was to improve understanding of current healthcare access needs of autistic patients accessing our services, but also that staff would be able to identify reasonable adjustments and be able to put those into place. So these bar charts show that after attending the programme, attendees did feel that their knowledge of autism increased, so from 5.4 out of 10 beforehand to 7.7 out of 10 after training, and that their confidence working with autistic patients also increased. I think in terms of reasonable adjustments, it's been a lot harder to quantify the impact of those adjustments. We can see that all participants could identify some reasonable adjustments they would make in their areas. It was harder to quantify the impact of these, and I think the time-limited nature of our pilot project meant that we haven't been able to follow that up with more long-term effects as yet. So as part of our training, we looked into current existing good practice, and we tried to share different ideas. Also, we were aware of a QI project that had been working on the distribution of children's healthcare passports throughout the Children's Hospital, and working with our colleagues in the IT systems to try and get those updated to medical records. We also looked at different existing resources like sensory checklists, and saw if we could adapt those to our departments. So we asked participants what they learned from this training. So I've just used direct quotes from participants. So someone said that they learned about preparation and the importance of explaining procedures and making sure that pathway and the procedures are very transparent. The importance of asking patients and families and making sure accommodations come from autistic patients themselves and their ideas. So we hope that that really came through in the training, both from the training being delivered with an expert by experience, and we used audio clips, video clips and case studies from patients that were kind enough to share those with us. And so other things people felt that they learned: how to adapt the environment. So we used an environmental checklist from South Yorkshire NHS partnership, and devoted a lot of time in the training to look at our departments and look at all the barriers in terms of the environment and the sensory environment and how difficult those can be, and just looking at those small adaptations. And again, going back to our patients and asking what adaptations they would recommend. I know we looked into the Peace Project from the Maudsley as well, and I know that patients there suggested, you know, really small adaptations, things that healthcare staff might not have thought of at all, like the jangling of their keys in the middle of the night, and that key cups to be put on the keys can really help with that horrible sensory experience. So we were looking for those small ideas of those reasonable adjustments that we could use. And so in terms of the main areas of learning that came from this project, we looked at the experiences of the autistic individuals, caregivers and staff that attended our programme, and adjustments were recommended in these kind of key areas. So firstly, the importance of training being co-created and delivered by experts by experience, and making sure that those barriers and suggestive facilitators are coming from people within that community.
Debbie, sorry to interrupt.
Yeah,
We're on 10 minutes now, just to let you know.
Fab. I'm just wrapping up. Brilliant. Thanks, Mary. The importance of pre-planning and preparation of families. So that was both in terms of ensuring professionals gathered that information beforehand, and patient-specific information. So going back to looking at the healthcare passports. And also, I know we've talked today about preparation of patients in terms of looking at social stories and videos, frequently asked questions, and making sure that that preparation is really transparent with information given beforehand. A key theme that really came through was collaborative working between staff and with families at every point in the treatment pathway. The value of reasonable adjustments, and that was especially in terms of the sensory environment and effective communication. So we really made sure that that was a key theme in our training delivered, and ensuring that care is tailored to the individual, ensuring person-centred resources and support is offered. So going back to the healthcare passport, sensory checklists, and making sure that there's not a one-size-fits-all, but that staff have a toolkit and an appreciation of individual differences and needs for adaptations. So that was a bit of a whistle-stop of our learnings. Have you got anything to add, Sarah?
No, well done, Debbie. I mean, I just think it's been a really fabulous thing to be part of, but it has only been a pilot, and we would like to continue this in the longer term because we see the value of it. And we've had lots of approaches from colleagues in adult services who want something similar for the adult acute care situations. And as you say, widening it to all staff groups, particularly those first point of contact admin staff, is something that we think would be hugely valuable. But thank you for allowing us to present today. It's been a wonderful day.
Thank you so much.